Hi everyone, I'm Dr. Melike Küçükkarapınar and I am a psychiatrist at Gazi University, Faculty of Medicine. It's a really great pleasure to have this opportunity to talk about the effects of coronavirus on our society from the psychiatric perspective. As you see at the bottom right corner, there is a QR code. With this QR code, you can reach at our survey link. Before starting to my presentation, I would like to share the important links that related with our survey. The presentation will take about 15 minutes, and I have divided my talk into 3 parts. In the first part, I'm going to talk about objectives and study design. Then in the second part, I'm going to tell you about measurement and main results of the study. Finally, I said something about conclusion and made some suggestions. As you know, the first case was seen in Chinese city Wuhan in 31st December 2019. This virus subsequently spread across the world and led to a pandemic known as COVID-19. The first case was reported in Turkey on 11th March 2020. As of 23rd November, the total number of reported cases in Turkey was 453,000 with 12,000 deaths. As it well known, there was a SARS epidemic between 2003 and 2004. And it was reported that the incidence of depression, anxiety, and post-traumatic stress disorder between 10% and 18%. Also, in a crisis such as COVID-19 pandemic, it's really important to monitor public perceptions of risk, protective and preparedness behaviors, public trust, as well as knowledge and misinformation to enable government spokespeople, the media, and health organizations to implement adequate responses and also to control the mental effect of coronavirus during and after pandemic. These are our research questions. And in this part, I will talk about our methodology or study methodology. This study is conducted online in a serial cross-sectional design with multiple data collections. Data collection began on 17th July. And for optimal monitoring, the data is collected in every 2 weeks. The survey is from World Health Organizations. With the standard survey, we aim to share our results and compare the other countries that participate this study of World Health World Health Organization. Sorry about that. These are variables of our study. There are so many, and I'm not going to share all results of variables in detail. Rather, I'm going to talk about risk perception and behavioral and emotional changes during pandemic. As I said before, we implement a serial cross-sectional study. Data is collected through an approximately 15 minutes web survey with 18 years of age and older Turkish adults. Each data collection period is 72 hours. In this part, I will talk about social demographic features of the participants. And between July and November, the total number of participants is 3,500, and most of them are female, well-educated, and non-healthcare workers. That's all I would like to say about percentages. In our survey, we asked participants how susceptible they consider themselves to an infection with novel coronavirus. Instead of in July, 35% of participants, in November, only 20% of the participants consider themselves very vulnerable to the coronavirus. And also, according to results of multiple linear regression analysis, people who are old, chronically ill, perceive coronavirus spread quickly, who know or think people in their social environment are infected with coronavirus, think that they are, consider that they are or could be infected with coronavirus. As you see in this chart, the perception coronavirus susceptibility is higher in all 2 weeks than seasonal influenza. We can see here the percentages change weeks by weeks. In the first 2 weeks, 45% of participants consider extremely likely getting infected with coronavirus, and these numbers increased last 2 weeks. People who are female think or know that people in their social environment are infected with coronavirus, who perceive the coronavirus and not close themselves but spreading quickly, not perceive themselves prepared for coronavirus, find their probability of getting infected with coronavirus is higher. This bar graph shows the comparison of the probability of getting infected with coronavirus and seasonal influenza. Except first 2 weeks of September, people find their probability of getting infected with influenza higher than coronavirus. In September, the number of reported cases increased quickly, especially in big cities of Turkey. This change could be related with the increase of the cases. The severity of illness of coronavirus, the perception of the severity of illness in all time ranges is almost same. And also, I would say that in this slide, according to results of the multiple linear regression analysis evaluating the risk perception for illness severity, older, chronically ill, highly educated people think more likely than young, healthy, and poorly educated people that disease is serious for them. At the beginning of September, people find the severity of coronavirus lower than influenza. But I will repeat again in this slide. Surprisingly, since September, the reported cases increase, and with the beginning of this slide, I will talk about emotions and behavioral changes during pandemic. Participants and worries and fears during pandemic. On the left, the participants find the new type of coronavirus is fear-inducing, but only 20% of them think like that. And almost 10% of participants find the coronavirus is worrying. In all 8 waves, the content of worries and fears were asked. The 3 biggest concerns are health system congestion, recession, and losing the loved ones. The level of worries are getting higher and higher. The last 2 slides. We added to the survey 2 months ago some questions related with our country's pandemic process, and here you can see here approximately 35% of people feel alone, and 25% of people having sleep problems and complain loss of interests. We would like to investigate whether people have difficulty in adapting to the measures to be taken during the pandemic process. And we thought that it may be a relationship between the increase of the numbers, increase of the reported numbers, and difficulty to adapting the measures. So we find that people have difficulties to adapting, not being able to meeting family and friends, and not being able to attend events, and it was 50% of participants thought like this. The study is still in progress, so we cannot reach at definite conclusions. Most probably, we will finish the study. We will have finished the study by the end of January, but it could be proposed that the pandemic has a greater effect not only on physical wellness but also emotions and behaviors of people. To prevent the later mental effects of the pandemics, the measures should be story determined considering the psychological effects. That's all I would like to say about the study for now, and that's the end of my presentation. Thank you very much for listening.